It's something that, you never think is going to happen to you. I think in a way is you're more afraid of what's going on and not knowing that, something is growing inside of you.
It's a hard burden to take. You look at life at a different perspective, I guess. You live life more to the fullest, I guess, like some people would say.
If you're watching this video, you or someone you care about has been diagnosed with cancer. It's not a diagnosis anyone wants to hear. At Mary Bird Perkins Cancer Center, we understand that treating you is about treating you and your cancer. We see you as an individual, not just a person with cancer, and we want to do everything we can to help you. Our entire focus at Mary Bird Perkins is fighting cancer. This focus allows us to better understand the physical and emotional needs of our patients and their families. That's also why we've brought together an extraordinary group of specialists from many areas of expertise, along with the most advanced cancer-fighting technology in the world today. We are so pleased that you are watching this video. It has information that will help you help us as we face your cancer together. On your first visit, we will also give you a handbook that has more detailed information. A member of our team will go through the handbook with you. We understand that you may have questions that are specific to your particular circumstances. These questions can best be answered by your doctor. The physicians and staff at Mary Bird Perkins Cancer Center are perfectionists. Ask around, and what you'll hear about us is that we're doing whatever it takes to help you face this challenge.
The way the staff handled me in approaching this particular treatment was something that made me feel very, very at ease. This is a first-class operation, and all first-class operations doesn't necessarily have good people, but they got excellent people.
The people that were doing the treatments at the time were wonderful, and everything that they did, they explained as we went, why they were doing it, how it was being done.
The first visit to a cancer treatment facility can be confusing and stressful. You and your family are faced not only with concerns related to the diagnosis of cancer, but must also contend with a major disruption in your lives. For this appointment, you may want to have a friend or family member accompany you. You will be receiving significant amounts of new information, and having another person there to act as an extra pair of ears, to take notes, to ask questions you might not think of at the moment, and to offer you emotional support can be a big help. We want to do everything we can to make you as comfortable as possible during your treatment at Mary Bird Perkins. Let's start right now by giving you a clear idea of what to expect on your first day with us. Each team member you meet with will be focused on making sure that everything possible is being done to ensure your comfort and sense of well-being. We encourage you to ask questions because knowledge is one of the most effective weapons against anxiety. During your first visit with the radiation oncologist, who will be your radiation doctor, you will decide together if radiation is the best course of treatment for your particular diagnosis. If you do choose radiation, your doctor will discuss your treatment options with you, let you know about any possible side effects, and together you will decide how to proceed.
The technology part of it was extremely new to me because I'm old and these new things are just amazing to me. And after I got in the center, I was introduced to these machines and the process that they were going to use them. It was really, it was just amazing. It was just amazing to me to see these kinds of things, and I didn't know all this was going on.
In addition, you'll be asked questions complete some forms, and receive an exam based on your specific diagnosis, so that we will have as much information as possible to carefully plan your course of treatment. Your doctor will immediately begin to develop your treatment plan. The first step in your treatment will probably begin with one or more scans called a CT scan or a PET CT scan. These scans take three-dimensional pictures or X-rays of your body and assist your doctor in making treatment decisions for you. Depending on your case and scheduling, we may begin taking these scans or images on your first day, or we may ask you to return for a future appointment. At this time, your team will also be busy doing everything possible to maximize the benefits of your treatment and minimize side effects. A technologist may draw marks on your skin to precisely identify the area of treatment. We may make special devices that will be used to ensure that your body stays in the exact same position for each treatment. Some of these procedures may require that you partially disrobe. A special changing area is provided for your privacy. At Mary Bird Perkins Cancer Center, we treat cancer using radiation. Radiation therapy uses high-energy X-rays or electrons to kill cancer cells so they are unable to grow, multiply, and spread. It's referred to by a number of different names: X-ray therapy, radiotherapy, or irradiation. Using our advanced technology, we're able to localize your treatment so that it precisely targets that part of your body and those cells affected by cancer. With careful planning, every effort is made to preserve as many healthy cells as possible, which reduces side effects. Most radiation treatment takes place over several weeks, 5 days a week, with no treatment on the weekend. Your team will work with you to establish a schedule that's as convenient as possible. It's very important that you not miss appointments because this can reduce the effectiveness of your treatment. During your course of treatment, you'll visit with your radiation oncologist once a week. As preparations are made for your treatment, your doctor will be joined by our team of cancer experts to create a personally tailored course of treatment designed specifically for you. We hope it helps you to know that your doctors are world-class experts specializing in complex cancer care. They and the rest of your team are ready to help you fight your cancer. Your team will include an oncology nurse who is always available to answer your questions, technologists who will gather the images that will be used to plan your treatment, and the therapists who will administer your treatments. There's also a dietitian and a social worker available at no cost throughout your treatment to ensure that anything you need to support your physical or emotional well-being is available to you. A financial counselor will review your case and, if you need it, provide insurance assistance or assistance with other payment options. But there is also a team of experts working behind the scenes to help you fight your cancer, like our highly respected medical physicists and dosimetrists who ensure that the equipment is perfectly calibrated and that you get exactly the radiation dose your doctor has prescribed. We'd also like you to know that Mary Bird Perkins Cancer Center has the largest medical physics team in Louisiana. Having such an outstanding medical physics team is critical in providing you with the best treatment plan possible.
Mary Bird Perkins is definitely the place I would come to pick out of any hospital.
We've given you enough information to reassure you that working together as a team, we will use every resource we have to fight this battle. Because you are so important to our team, we'll be asking you for your feedback. When you finish your course of treatment, you'll be given a patient satisfaction survey. We listen and learn from what you tell us. We believe that's why 98% of those who come to us for treatment say they would recommend us to a friend or family member.